There's three stools of success in healthcare. We want to reduce cost, we want to improve access, and we want to either maintain or improve quality. And sometimes those are adverse to each other. I mean, if we continue, if take Medicaid for example, where the quality is just not there. You see studies, one in Oregon that said that the health outcomes for people on Medicaid was no better than the uninsured. And so a program like Medicaid doesn't need to be expanded until it's reformed. And that's why I opposed Obamacare's Medicaid expansion here in the state of Florida, because there's significant reforms that need to take place before we even think about expanding into that population, which is mostly, the vast majority of which are healthy adults, working age adults, not our true safety net that we already take care of under our Medicaid program. And so that's one area, but I think we can do a lot more to lower cost. We talked a little bit before we went on air about transparency, and we've got a bill this year that will allow Floridians to look at cost and quality measurements across the state of Florida and see where some hospitals or some healthcare providers are not doing a very good job, while others are doing an outstanding job, and be able to shop and go to places to seek healthcare where they'll get the best healthcare outcomes. The same thing on the cost side of the house, and we have a bill with our state employees so that if they go and are able to save money, for example, an MRI that may cost $1,000 on Adams Street over on Jefferson Street costs $3,000, that difference, that saving difference, can be shared between the taxpayers and the employee. So if they shop enough and think ahead enough to say, I'm going to go get the same quality procedure through that MRI, same machine, but it's just the variance in healthcare cost is very, very wide. Why? Because most of us have a deductible, we have a copay, and we really don't care what things cost. I mean, as citizens we do, but as consumers we don't have an incentive to care. And so doing things that allow people to participate more fully and have more of a patient-centered healthcare reform is a priority for me. One of those things is bringing a closer relationship between your doctor and the patient. And we have the direct primary care bill that passed out. I was a co-sponsor of that bill that says for your direct primary care needs, you can contract directly with your doctor. There's no insurance, there's no government. And those are the dual bureaucracies in our healthcare system that oftentimes doesn't allow for the market to work, and doesn't really allow sometimes for the patient to truly have a relationship, a close relationship with their doctor. We get bounced around, and a lot of people that might be able to benefit from this program are going to the emergency room instead of going and developing a long-term relationship with a primary care physician, so that if you have diabetes, say for the indigent, that oftentimes they're non-compliant in taking their medication, their insulin drugs. By having that closer relationship with a primary care physician, you're more likely to have follow-up visits, more likely to have somebody that's invested in your health, that cares about your health. You're more likely to follow his or her instructions. So that's another area where I think we're going to make improvements in improving the relationship between the patient and the healthcare provider.